I'm Kim Keebler, the Editor-in-Chief of the Multiple Chronic Conditions Resource Center, and proud today to have two special guests discussing the determinants of health and rural care. We have Director Jim Haveman, and he has a pretty impressive bio. Director Haveman was appointed by two Michigan governors, Governor Engler and Governor Snyder, as the director of the Michigan Department of Community Health. He was chosen to drive the state's aggressive health and wellness agenda for over a decade. Prior to this, he was appointed by Governor Engler as director of mental health in Michigan for 5 years. In 2003, he was appointed by the White House as a Coalition Provisional Authority senior advisor to the Iraq Ministry of Health. He was Iraq's acting Minister of Health for the first 3 months of his 11-month tenure. During this time, he served as a senior health advisor to Ambassador Paul Bremer. Previously, Director Haveman served as the Executive Director of Bethany Christian Services, the Executive Director of the Kent County Community Health Mental Health Program, and the Executive Director of Project Rehab, a substance abuse program. All of these are in Grand Rapids, Michigan. He has received numerous awards and tributes, including the National Governors Association Distinguished Service Award in 1998 and the Department of Defense Medal for Distinguished Public Service in 2004. In May of 2023, he was awarded an honorary doctorate degree in public health from Northern Michigan University and was the commencement speaker. He currently is president of the consulting firm, the Haveman Group. He is a board member of the Grand Rapids Public Museum Foundation and Ortel Health. He serves as the finance chair of the Blue Cross Blue Shield of Michigan's Foundation Board. He has served as trustee on the boards of Ferris State University and Northern Michigan University. He is currently one of the 3 co-chairs of the $5 million expansion enhancement of the Grand Rapids Public Museum. And I have to mention that Jim is probably one of my favorite people. So I'm honored to have him here today. And Elise Bur is the director of the Northern Michigan University Center for Rural Health. This is just a brief overview of the center. We have attached the full description of the center that includes its mission, vision, position statement, and programmatic focus areas to this podcast. The center was established in July of 2020. The Northern Michigan University Center for Rural Health was created to strengthen the rural healthcare system throughout the Upper Peninsula of Michigan. It is a collaborating center of the Michigan Center for Rural Health and using the World Health Organization framework for collaborating centers. The center was developed as a network of committed partners who have demonstrated efficiencies in healthcare delivery by expanding access to health care, increasing the coordination of care, and improving the quality of healthcare services. The establishment of the center strives to improve person-centered outcomes, reduce costs, promote access, and coordinate transitions of care by promoting innovative approaches in the region. And Elise, as I mentioned, is the director of this center. She has an impressive history of higher education and healthcare administration. So before we get started, I just wanted to mention that just yesterday, the Primary Care Collaborative, together with the Robert Graham Center, released a report titled Closing the Distance in Rural Primary Care. This important overview is not only due to the massive closures of rural hospitals across the country, but also acknowledges that rural residents have higher rates of chronic conditions, poor behavioral health, higher mortality rates, along with greater risk for opiate overdose. According to this report, there are 15% fewer primary care providers on a population basis versus other geographical locations. And most recently, the passing of the large federal tax and reconciliation legislation package this year has planned to cut Medicaid spending with a prediction that this funding will fall by $137 billion in rural areas over the next decade. Also, this past week, United Healthcare announced that effective January 2026, They will no longer provide coverage for remote patient monitoring for most chronic conditions that include diabetes and hypertension. They will, however, continue to monitor heart failure. This podcast, as I mentioned earlier, couldn't be timelier. Approximately 61 million Americans live in rural areas, which is 1 out of 5 people. The number who receive rural health care depends on their access to facilities such as health clinics and hospitals. Jim, given your experience and perspectives as the director of the Michigan Department of Community Health and experience as trustee for the Northern Michigan University, why did you advocate, despite strong opposition, for the establishment of the Northern Michigan Rural Health Clinic?
Well, first of all, it's good to be on this podcast with both you, Kim, and Elise, both people I have great respect for. I was a trustee of Northern Michigan University for 4 years, from 2017 to 2020. And when I was director of the department, we dealt with the Michigan Center for Rural Health with John Barnes as director, and basically doing the type of things that you'd expect in training and grants and really advocating for rural health issues. And I always respected what that center did. And as a trustee, we had some opportunities to start some initiatives over the objection of the president of the university. And one of the things we thought about was, why not a Center for Rural Health in the UP that would have a relationship with the center in Lansing, which was the capital, but also Northern Michigan University could then kind of own the Upper Peninsula as it relates to education, training, research development, innovation, partnerships, collaboration, how you could, the UP is 350 miles long and about 125 miles from north to south. That has 29% of the land of Michigan, but only 3% of the population. So 3%, 30,000 people live in the UP. So what a great opportunity for a rural center of Northern to really take the initiative to start to make things happen in a cooperative way with the federally qualified health centers, the rural hospitals, the tertiary hospital, and the community mental health boards. And so that's how that center began and why it began. And it was funded by Northern. And Elise has done a great job by bringing in additional grants and other support.
I didn't realize that the demographics of the Upper Peninsula were so bleak, but I know it's a big area. Elise, the concept of determinants of health are at the focus of many state and federal initiatives. Can you describe how the determinants of health are implemented in your clinic? And I know this is a two-pronged question, but also, why did the clinic decide to implement the World Health Organization framework for collaborating centers?
Yeah, well, just to clarify, we're actually a center for rural health. We're not a clinic. We don't provide direct services to patients. But I think what's really important is that we decided to follow that WHO model because there was a close collaborative effort with the Michigan Center for Rural Health, and it just seemed like an ideal fit. I have lived in the Upper Peninsula, Michigan for over 30 years, and I've established a lot of relationships, having worked at a hospital in the Upper Peninsula as well as a federally qualified health center. And what I've noticed over the years of living here is that the social determinants of health obviously impacts the health of the people who are living here in this rural area. And we've done a lot of work to train and certify community health workers throughout the Upper Peninsula, Michigan. In the last 2 years, we've trained 120 individuals. Prior to that, we had determined there were 12 people that were certified as community health workers up here. What I think is interesting is that it's always relied on clinics or hospitals to employ these community health workers. And as it turns out, about 3/4 of the individuals we've trained actually work at social service agencies across the region. And so what's occurring now is that instead of it having to heavily rely on a health component, people are now having these determinants of health addressed regardless of where they're accessing care right now. And these communities are coming together to connect people to community resources. And so now as a region, we're actually approaching social determinants of health and addressing those issues versus relying on the health institutions to do it.
So Elise, for our audience, can you provide some examples of what some of these resources are?
Sure. We're taking a look at everything from transportation to access to food, access to health care, access to mental health. It just is a variety of things. What I've talked about throughout the region is that these same things that are considered barriers to care are also barriers to education, and they're barriers to further developing our regional economic platform. And so by addressing these, it's just lifting up the entire area. What I would like to be able to do moving forward is that as we indicate how many people have needed connections to these resources, how do we go back to those that are developing the economy and making decisions in their community that may otherwise have not realized how many people are actually being connected to those resources?
Elise, excuse me a minute. Elise, could you comment a little bit on your summer camp for kids?
Yeah, one of the components that we're starting to focus on is the future workforce in healthcare. And so we put together a summer camp for 9th and 10th graders throughout the Upper Peninsula who may be considering a healthcare career in the future. This brought together about 50 different health professionals throughout the region to share insight into what their role and their responsibilities are in their particular health field. And it exposed the students to just a wide variety throughout that entire week. And we had a lot of students that left the campus with a better understanding of what they might be able to do. And I will say that I think one of the highly valuable things about this was that many of the healthcare providers who spoke at that camp and engaged are people from the Upper Peninsula. And so students all of a sudden can see themselves coming back and being a part of this community. And I think rural areas right now across the nation have got to they've got to be better equipped, and they've got to take a stance to really grow their own, because people aren't going to come in and necessarily save rural areas. We've got to look at just different techniques and strategies for really trying to sustain healthcare industry.
That's very innovative. Thank you, Jim, for bringing that to our attention. As you both know, the prevalence of multiple chronic conditions represents the nation's largest patient population, with 4 out of 5 Medicare beneficiaries. Yet the health problems for those younger than 65 require attention and resources. Is the Rural Health Center, invested in prevention along with the management of symptomatic conditions?
Yeah, we do a lot with education to try to educate people about things in advance, about especially conditions in rural areas. We have a high prevalence of prediabetes in the Upper Peninsula of Michigan, and as many know, that's a state that, or a status that can still be reversed and corrected at some point, depending on that progression of diabetes. So that's something that we've focused a lot on. I think we're also looking at unique deliveries of care that haven't existed. In our region, one of the grants we recently had received allowed us to build a community paramedicine program, which otherwise had never existed in our rural area. And these community paramedic programs are popping up in urban areas, but this gave us an opportunity to show how could this impact the delivery of services and access to care in a rural setting. And so we just started piloting that program in May of this year, and now there's 4 other areas in the Upper Peninsula of Michigan that are looking to replicate that service line.
Great. Jim, with your work at Blue Cross Blue Shield, the foundation, are they doing any work with prevention in multiple chronic conditions?
I think as much as possible, the foundation has partnered with other foundations around the state to really focus in on evaluating innovative programs that work, particularly in a preventive way, getting ahead of the diagnosis, whether it be in mental health, behavioral health, substance abuse, kidney issues, diabetes issues, a lot of emphasis on health literacy, increasingly involved in aging issues, uh, giving people the tools to make their own decisions. So yes, I think the shift, we still spend 4.5 trillion on healthcare in the United States, but what, 90% of it's chronic and about 70% of it's preventable. So I think many of us who've been around for a while feel like we really failed in really moving to the preventive part of the model, and I think that's where a lot of our focus is going to be and continues to be through the foundation and through other insurance companies.
It's important. Director Haveman, this is kind of building on what we were just talking about, but you have been at the helm of progressive healthcare legislation and were ahead of the curve in many areas during your 12 years as director of the Michigan's Department of Community Health. Were you able to see shifts or prevalence in the cost of chronic conditions, and was this a consideration in your promoting of the Northern Michigan University Rural Health Center?
I think so. I think the main issue has been improving access. I really appreciated Elise's efforts on social determinants of health, and it relates to transportation, health issues, literacy issues, regards to how to use an enrollment card. Michigan is a Medicaid expansion state. A lot of the insurance companies, like the Blues, have moved to pay per performance and looking at metrics for outcomes and bundled payments, but we still have a long ways to go to make a dent. Now, what concerns me right now is that I think all of us in urban rural health are going to be facing a couple of years of chaos because of the tax on the 340 B program, the issues of telehealth reimbursement, the ACA, and the list goes on. And even in the Medicaid expansion with the new work requirements, you're going to see less people because of cumbersome be involved in health plans, which we have 700,000 involved in Michigan. But the thing that gives me encouragement, even though we got all these chaotic situations we're facing, is that rural health are resilient people, and they'll find a way. But we've got to start looking at, there might be some legacy programs that maybe need to end, or we might need to think new ways of educating our community. We might have to invite new partners in, whether it be the Kidney Foundation, the diabetes folks. We can't do it all. And I think all the health programs are going to have to open up their doors to really talk about more accountability, how the money's being used and what the expectations are, but being honest with the communities that are in, that they can't do everything, and that some of that responsibility for healthcare going to have to be shifted to the consumer itself. And that's not going to be an easy thing to do, but I think some pivots are going to be necessary immediately to adapt, because if we don't do anything, you're going to see a more closures of rural health centers. You can see more closures of hospitals in the rural areas, and we can't let that happen. And that's where the association's got to advocate. We got to keep educating legislators. We got to keep educating the community as to the impact. We can't go backwards. We have to go forwards.
Elise, you mentioned a couple of the programs that you're working on. Are there any other programs that you think our audience would like to learn about? I think that Michigan has an opportunity to demonstrate, strong rural model with our, the diversity of the Upper Peninsula, diversity being a rural residents. And also, just out of curiosity, how are you funded?
We were initially funded on a HRSA grant that we received just to establish the center itself for the first year. Since that time, I've been added to the baseline budget for Northern Michigan University, so the university has invested in our center to exist. Currently, there's 2 of us that work at the center, so very small but mighty team. And we've been able to receive up to pretty close to $2 million in grants to be able to do work in the Upper Peninsula, Michigan. And a part of that is credit to the Michigan Center for Rural Health for being one of our partners on applications. I would say, in addition to growing the workforce and looking at new models of care, another project that we've been working on over the last few years that focuses on the preventative side has been working with the Literacy Legacy Fund of Michigan and Copper Shores Community Health Foundation. We spend March and April going into elementary schools and educating second grade students about oral health care. We provide them an oral health kit. We take the pre-dental students at Northern Michigan University and we teach them how to floss, how to brush. We give them a tips sheet to take home to parents. This project ran very successfully in the central part of the Upper Peninsula, Michigan, and my friends at Copper Shores Community Health Foundation reached out and said, hey, we want to replicate this up here. Can you come up and train us? And so now we've trained high school students up in the Copper Country area, and through this program over the last couple years, we've been able to reach more than 1,000 students a year. Over that 2-month period. And Literacy Legacy Fund of Michigan is excited because it's teaching students to read. They receive a book to take home. Curious George visits the dentist. And, some of the scariness of going to a dentist is kind of removed from their minds, and they see a different side of it now.
An important area. Jim and Elise, you both are doing a lot of work in an important area. Jim, you've touched millions of lives during all of the things that you've been doing throughout your career. Is there anything that either one of you want to say to add to this podcast before we disconnect?
Well, one of the things I think Elise touched on, which I really appreciate, we have maybe 40 different public health department counties structures in the state, 47 different community mental health boards. What Elise is able to do in the UP is demonstrate, what's working in some areas where other people can learn from. So we don't have to sit isolated trying to do it on our own. That this is a regional approach to healthcare, and she can provide that vehicle. And I think that model can be replicated elsewhere. We're way too isolated from each other in the health field, and we just got to have more sharing of what's working and getting rid of what's not working.
Absolutely.
From my perspective, I just came back from a meeting downstate this week, and I think it's really important that as these larger urban areas want to make an impact in rural, that they really need to understand we need them to do it with us and not for us in a rural setting. And so truly being a partner and allowing that engagement to occur in collaboration is what's going to make a sustainable impact in the future.
Well, Michigan is my hometown, or my home state, so I'm proud to highlight the work that you're doing, and Jim, all the stuff that you've helped get up off the ground. Appreciate you guys, and have a great holiday.
Thank you very much, Kim.
Thank you.